Do miracles happen? Do doctors believe in miracles? Hi, I am Manan Desai, cardiac surgeon. To find out answers to these questions, listen to my heart to heart chat with Nima Mankar on her podcast, Bounce Back with Nima Mankar. Matters of the heart, they'll say.
Hello, everybody. Welcome to the eighth episode of Bounce Back with Nima Mankar. Today, we have with us someone who comes all the way from Washington, D.C. to take care of all our heart problems. So, listeners, all of you, please open up your heart and welcome Dr. Manan Desai. Well, Dr. Manan Desai graduated from MP Shah Medical College, Jamnagar, Gujarat. He did his surgery training from BJ Medical College, Ahmedabad. He did his specialization from the Premier Medical Institute, All India Medical Institute of Medical Sciences, New Delhi. There he received extensive training in adult and complex paediatric surgeries, including robotic surgery. After completing his training, he served at Mehta Institute of Cardiology and Research, Ahmedabad. Soon he got connected with the leading hospital of Ahmedabad, CIMS Hospital. Along with a team of highly qualified doctors, Dr. Desai is committed to provide world class healthcare with cutting edge technology that says your heart is in safe hands. Dr. Manan Desai is proud to be an integral part of the team which did the first heart transplant in Gujarat. After a fellowship in pediatric cardiac surgery at Children's National Washington, D.C., he is currently with Stanford Hospital University, Lucille Salter Packard Children's Hospital as a clinical instructor. He is involved in care of children with complex congenital heart diseases. So, hello and a big hearty welcome to you, Manan.
Thank you, ma'am. Thank you for the opportunity of sharing the space in this podcast, which is gaining a lot of popularity. And I congratulate you on this endeavor and wish you all the best for all future episodes.
Thank you, Manan. We would love to hear a little about your childhood, your education, your family.
When you ask me about childhood, it's a tsunami of memories, all primarily good memories. A lot of them revolve around Baroda High School, the same where you were a teacher, and I have fond memories as your student. A lot of mischievous memories, fun-filled time spent with friends. I was a head boy in the seventh grade, and me and Chirayu and our gang was notorious, and at the same time we were good in studies too. So a lot of nice memories. Also, we had the Discover Vadodara when I was in the seventh grade, and that was also very nice. We had done that Hawaii and all those shows, and it was a grand success at that time. Those were the formative years of my life. They kind of made me who I am today. So I'm filled with gratitude with all the teachings I got from you and other teachers of Baroda High School. My mom was a banker at the state bank, and my dad was an engineer. And I used to look upon my mom because she was so hardworking, and in those time, working women was not that common, and she has a lot of contribution in my upbringing. My younger brother was also in Baroda High School, the same school, so it was nice. And every time they used to tell, "Oh, Manan was like this, Manan was like that" to him, and he always used to look upon to me as a as a friend, philosopher, and guide.
You are in an amazing profession, which is looked up with such wonderment. We wish to hear something more about it.
Yeah, I mean, being a doctor and being a heart surgeon, I have a unique opportunity to touch on people's lives and people's hearts. So I considered myself very fortunate to be in this position. and I take my profession with great responsibility and humility. I'd like to tell a quote from a book I recently read. The book is Breath Becomes Air. It's by a neurosurgeon who finds that he's got the diagnosis of cancer and how he kind of fights the disease and how he feels when he changes from a doctor to a patient. So when he talks about his profession as a doctor, he says that and I quote, the physician's duty is not to stave off death or return patients to their old lives, but to take into our arms a patient and family whose lives have disintegrated and work until they can stand back up and face and make sense of their own existence. I like to look at patient as an inclusion of his entire family. And being a pediatric cardiac surgeon, I have to deal with parents more than the small babies themselves, so far as counseling and stuff is concerned. So I have to kind of take the family as a whole and see to it that they go through this tough phase, and I kind of build their morale and help them in any which way I can. A couple of incidents I remember very distinctly, and kind of I'll tell you an incident about one of the heart transplants we did. This is a patient who's like a 21-year-old boy of Surat. He's kind of about to go to the college, but his heart starts failing and he's kind of not able to move about anymore, and he's restricted to bed. And at that time, we had just done like the first heart transplant, and he was going to be the second one. We got the heart from Surat and did the heart transplant. And once we put in that heart, and that heart kind of starts beating from a dead person's chest into a new person's chest, and to watch that heart beat vigorously in a new chest in a new person is a breathtaking sight. It is a sight one should behold, and if one sees that, is permanently affected by that sight. So such a moving experience. But unfortunately for that patient, what happened was that the heart didn't beat as we would have wanted to. It was beating very weakly. That is kind of one of the nightmares for a surgeon. You have heart which you have got out of the chest, which was not working properly, and then you put in a new heart which is not working as well. So you are kind of stuck in the situation where if that heart doesn't start beating, then the chances of survival are very less for that patient. So we were like, this is just our second heart transplant and the heart is not beating well. So we transferred the patient to a support system called the ECMO, which supports the heart and lung for a temporary period of time. And then we transferred that patient to the ICU, and we were kind of talking to other centers which had done heart transplants and wanted to get their inputs about what's the way forward. We started all the medications to get that heart going, and I almost slept by the patient all night, and until early morning the heart had not started functioning. And then when I'm trying to discuss with the other doctors that what should be the way forward, whether we should take a biopsy and check what's the implanted heart, is that heart undergoing any acute rejection, like the body is not accepting that heart. And right when I was doing that, and I thought that I'll talk to the parents and start explaining them that this is the situation and this is our plan, I went to that room and miraculously that heart had started beating. I was so thrilled and overjoyed. And I mean, although we had started all the medical treatments, that was a sudden change in the patient's clinical status. So I mean, that's when I say that miracles do happen in medicine.
This was really like a miracle, yeah.
Yeah. When I was getting the heart from Surat, I saw a formation in the clouds of sun rays coming out like fingers from the clouds. And I remember reading a story in Reader's Digest when I was a kid about a patient of hemophilia who was undergoing treatment for hemophilia, and then he got AIDS because of multiple transfusion. At that time, AIDS was a very new disease. And when that patient was kind of dwindling in his medical status and doing poorly, when he was in a flight, the sun rays from the clouds, which formed the pattern of fingers, he called them fingerprint of God. That was in my memory. And then when I was getting this person's heart, and then I saw that same formation, and then I posted on Instagram that this is fingerprint of God while I'm getting doing something noble, because I didn't want it to disclose many things that okay, we're doing a heart transplant. I said just fingerprint of God, and I just put it on Instagram. And after that patient got discharged and he's back to his normal life, he sent me an Instagram request and I accepted it, and he liked that photograph. The same patient who was miraculously saved was like appreciating the same photograph in which I was carrying his heart. So those are the kind of nice memories we collect along our way as medical professionals. Another incident of a kind of a medical miracle with our intervention, of course. I mean, I'd been to this shibir by Acharya Shivani, especially for doctors, and she gives very good lectures to doctors about spirituality and how spirituality and medicine blend together, and how we can spiritually support ourselves in our profession. She said that doctors should consider them as medium, like they're not doing it themselves, but like God is doing it through them. That takes away ego from our profession, and that also gives us confidence when we are going through such hard times, when like we are doing everything to save the lives of people and the patients, but sometimes we are successful, sometimes we are not. So it keeps us going, it gives us the energy to keep going. Right now I'm unfortunately not be able to help the patients in India right now, but I'm in touch with my colleagues who are kind of working day in and day out trying to save lives. And there's a kind of hard work that needs boost, like supernatural energy from spirituality and stuff like that. And miracles like this are give us hope that the more we keep working, the more good results we can get. So the another incident which I was is another kind of, the couple of them like that, but this particular one is permanently ingrained in my memory, was that there was a patient in the cath lab, and during the cath lab procedure there was kind of a hole in the heart, and the patient was bleeding in the pericardial sac, and that was a pregnant young female. And the blood pressure was precariously low, and we had been called in for an emergency surgical intervention, and I just had to rush in and open the chest urgently and kind of repair that hole. But her pressure had been low for a little longer than we would like. So I was like, whether the baby will be safe, whether the mother will be safe. But the next day morning, I go to the ICU doing my rounds and find that both the mother and the baby are safe, and the patient is opening eyes normally, and her all entire neurological exam is normal. And I was so thrilled, like all the kind of stitch in time saved the life of two people, not only the mother but also of the baby. So I have the opportunity of kind of, I consider myself fortunate that I have this opportunity of affecting people's lives and saving lives.
Yes, doctors are really like gods to human beings. Okay, I want to know, did you ever face any setback in your life?
My setbacks have been primarily, trying to achieve my goals. I have never got my things like easily. I have to really struggle for at each stage. When I was in Jamnagar, I was hoping to get into surgical sciences because I wanted to kind of, I saw myself as a surgeon, like treating patients with my own hands. That's what I always wanted to do. Even when I read about these things in Reader's Digest and all, I was always fascinated by surgery in general and cardiac surgery in particular. So that's what my dream was. So when my graduation got over, I didn't get into the surgical field. So I went to Bombay for specialized coaching for this entrance exam, and I was so sad leaving Jamnagar because I had stayed there for 5 years and I was so bonded with that place and the people there that I wanted to kind of continue there. But unfortunately, I couldn't. But in the end, I ended up getting a better place to pursue my higher education. So that was a kind of tough phase when I had to kind of go to Bombay for those coaching and get those, and at the same time do an internship at a totally new place. And you know how Bombay is crowded. It is, you go by local trains for the classes and you get a free body massage. Yeah, but yeah, so that was when I was applying for surgery. So I had to work hard for one more year to get into surgery. And when I wanted to go for cardiac surgery, the same thing happened. And my son was just born, and I had to leave him like 2 months old. I had to leave and go to Delhi because I wanted to pursue higher education in good institution in cardiac surgery. So I decided I would either go to Delhi or there's another institute in Trivandrum, Shuchitra. So those were the two. My goal was to get into those two institutions. Again, I every time I used to appear for those entrance exams, I used to score good in the written exam. But when I go for the interview, they ask how many cardiac surgeries have you assisted, have you participated, have you seen any cardiac surgery. So then my answer used to be no, because I was just finishing my general surgery. And then that was a kind of setback. Then I worked in hospitals in Delhi in cardiac surgery, and over the period of like 1 year I gained more experience, and then I got into AIMS. So that was a very satisfying moment for me when I got into AIMS, which is a kind of one of the best institutes to get medical education in India. And that kind of training has always kind of helped me in my career.
I have known you as a very, witty person, always jovial and jolly. Did this part of you help you to bounce back to, success?
Yeah, as a person, you become much more resilient, I think, if you are a kind of jovial and happy and you're not bogged down by failures and you just keep focusing on your goal. You're less likely to slip into depression and giving up if you are. I just like think to myself the song Rajesh Khanna, जिंदगी एक सफर है सुहाना, यहाँ कल क्या हो किसने जाना. So I just look at what's in my hand and just keep focusing on my work and leave everything else to God. And I also kind of remind myself of a quote I read in a book. I recently read a book called White Darkness. It is about a person who crosses the continent of Antarctica. It's a quote by Robert Browning. It says, I hold that a man should strive to the uttermost for his life's set price. So we are all kind of destined to something, and we should not rest until we achieve that, like what Swami Vivekananda said, arise, awaken, stop not till the goal is reached.
Could you share a few humorous episodes of your life?
Yeah, there are several. I was thinking today, when you first became our teacher, when we were in fifth grade, you asked us to write an essay on window shopping. And at that time, I did not know what window shopping was. And I wrote an entire essay about me playing cricket and how I broke the window. And me and my dad went for getting a new window. So then you told, no, this is not window shopping. You've written the essay so nicely, but this is not window shopping. But now that I'm married, I have learned the hard way what window shopping actually means. Then me and Chirayu were kind of the very naughty students in school. So when we were selecting subjects for our 10th grade, there was like, I wanted to go for Sanskrit, and Chirayu didn't want to go for Sanskrit, which kept us in different classes. So this is our morning assembly time. The classes are being divided according to the subjects, and me and Chirayu are different class. Then Chirayu decides to walk over to my class and say, okay, I'll do Sanskrit. But the principal of the school sees Chirayu crossing over to our class, and she announces in front of the entire school that Chirayu and Manan cannot be in the same class. So that was really funny, and we were totally astonished that our friendship and our stories of mischief are so famous that the principal even doesn't want us in the same class. So that was really funny. Another funny incident I remember when we were transitioned from 10th grade to 11th grade, we had the science subject. So I stayed with Baroda High School. And you just have to fill a simple form and you just get admission into the 11th grade. But there was an asterisk next to my name saying you have to meet the principal before you get admission. So my parents had to meet Havewala madam that Manan is very mischievous. If he wants to pursue science here, he has to be better. So I was always known as a notorious and a mischievous student, but here I am. I ended up being a doctor, not only being a doctor. That's a kind of if students who are like a little naughty, they can feel get solace in that thing that even if they're mischievous in lower grades, they can push harder and become a doctor.
Now, during stressful situations, the heart is affected the most. I'm sure our listeners would be grateful to get some words of wisdom from you.
Yeah, these days we are saying that the stress levels are going so high. Not only, I know this is the corona time, but even before corona, if you see our lives are getting more and more stressful. There's more competition, you're expected to deliver more. So I think these things are bearing heavily on the health of individuals. We are seeing more younger people having cardiac disease. We are seeing more younger people having diabetes, and that's that's something which should that's preventable in the sense if we kind of learn to manage the stress better, we can make sure that we live healthily and happily longer. So stress management is being emphasized more and more in corporate world. I personally think mindfulness is a very important tool in calming down our system when it sees stress. So the mechanism of stress is built into us for like fight or flight mechanism. Like when we were hunter gatherers, we are seeing a lion, we are supposed to either fight or flight. So that releases so many chemicals in the body that are not good for us. So we need to train our mind into thinking that this is not a fight or flight situation. And all these teachings of sages of all these years comes in handy when we kind of try to practice mindfulness to try to focus or rather defocus and calm down our mind. So my advice to younger generation would be to handle stress with mindfulness, at that same time keep exercising and healthy diet. Those kind of three things are the cornerstone of, I think, in these days, of a happy and a healthy life.
People, after recovering from the COVID attack, when they reach home, they get a cardiac arrest and then they lose their lives. So, what is the reason for it?
Yeah, so since I'm not on the front lines this time, I did reach out to a few friends about what's the situation there, and they did say that it is not that common. There have been reports like that. There have been incidences like that. The thing with corona is that it's a new disease and we are learning about it, and it's still an ongoing process. So, and again, I'm not an expert on this thing and not on the front lines, but this is what my conversation with my colleagues back home has I've learned is that corona causes a disturbance in the coagulation system. So we're thinking the reason for the sudden cardiac death should be clot formation in the coronary artery supplying the heart. So why exactly is this happening and what kind of patients are at risk, we don't know. But we usually follow the coagulation parameters like D dimer, and we are using that to guide blood thinning medication. So most patients are leaving the hospital with blood thinning medications for this reason. because of the high incidence of thrombus formation. Yeah, I mean, the medical fraternity is aware about it, and it's the treatment for that is being given at the time of discharge, is what I understand.
Okay, thank you so much, Manan, for such an informative conversation. I'm quite sure that listeners would want to listen to it again and again, to go back to this conversation and to listen to what you've said. So, dear listeners, if you enjoyed this episode, then please do tune in again on 3rd of next month for another enlightening talk on Bounce Back with Nima Mankar. Thank you, Manan and Envis, for the technical support.